In today's Eye on Health, we're talking about something that plagues millions of Americans, really of all ages, back pain. If you or a loved one suffers from back pain, you know it can be debilitating, but you don't need to suffer. We're going to show you a few exercises that can help, but first, Dr. James Jones with Allegheny Health Network is here to share AHN's approach to lower back pain care, and joining him is a recent patient who found relief, April Fisher. Thank you both for being here. I really appreciate it. And doctor, this is so widespread. Sometimes it's a temporary problem for people, and sometimes it's really kind of a chronic thing people deal with, right?
Right. Studies have shown that anywhere between 4 and 33% of our population at any time has low back pain. Low back pain is a consistent top 10 complaint in our primary care offices year after year. And April, tell us about your story. Like, how did you develop the back pain, and how bad did it get?
So I'm a very busy, active mother of 4. I am always trying to stay fit. So between triathlons, running marathons, and yoga, you know, the pounding of the pavement sometimes takes a toll on your lower back. So obviously Dr. Jones is a phenomenal PCP, really cares about his patients. And I went in to see him, and I knew that it wasn't going to be anything that I couldn't fix. And so he just gave me the exercises, and it was lickety split.
Oh, really? So when you started doing these exercises, and we're going to show some of these coming up, you felt a difference right away?
Right away, right away. I feel as though, you know, the lower back pain is such a common problem, and it makes people very nervous, you know?
Sure.
So if there's a solution like this out there that can fix people up, then it's definitely something to entertain.
How bad did it get for you before you called to make the appointment? I mean, did you have trouble sleeping at night? Did you not miss days at work? Do you know, that sort of thing?
It was definitely painful in terms of sleeping. I tried not to let it affect my daily living too much. You know, Tylenol or whatnot, but like I said, it's funny that she was just doing yoga.
Yeah.
I do yoga, and one of the stretches that he'll be demonstrating is similar to a yoga pose, and so after Dr. Jones showed me the exercises, it just really helped.
That's fantastic. Doctor, tell us about the approach with AHN, because you guys have teamed up with really a world-renowned guy to create this holistic approach. What's that mean? Well,
you know, we knew that we hear in the news a lot about healthcare costs and medical costs going up, and we knew that low back pain affects a lot of different people, and it's something that we could take and help reduce the cost and the way that we treat low back pain. We partnered with Dr. Hamilton Hall, an orthopedic surgeon from Toronto, Canada, who's been doing this for over 40 years, and he came up with the Patterns of Pain program. What it does is it really tailors the treatment specifically to the patient. How back pain used to be treated is whether you had left-sided, right-sided, constant, intermittent, whatever you came in with, you probably got an x-ray, some medication, and exercises at home that were the same for you and everybody else. Well, we know that everyone's back pain is different. So the difference with this program is we tailor the treatment program specifically to the pain that you're having.
And it's stuff that people can do at home, these exercises, so they don't have to run into a clinic or whatever.
Right.
You know, okay.
Now, we do have Allegheny Health Network physical therapists trained on this method, so it's really nice to get the same terminology and same methods when you do have to go to physical therapy.
Right.
But one of the mainstays of this is that this is stuff you can do at home. Most of this back pain you have, it's mechanical. It's nothing you'll need surgery for, and it's something that we can handle at home.
That's great news. All right, so let's head over to Mikey Hood and see some of these exercises in action. Hey, Mikey.
Hey, David, thanks. I'm with physical therapist Zach Jones, and he's going to show some exercises to help with your lower back. Now, Zach, you didn't bring any goats, but that's okay. I'm going to give you a pass.
Left them outside.
All right, all right. So now, this is something that you want to start. You want to get your doctor's permission first, correct?
Absolutely, yeah. And as Dr. Jones mentioned, what we do in the clinic, whether it be in his office or ours, is classify you into a pattern of pain. So it really helps to direct treatment. We're not really telling clinicians how to treat, but it kind of gets that jump start.
Okay, and so now what materials would you need? It looks like you just have a blanket.
Pretty simple.
I have a chair here. I'm ready
Pretty
to go.
simple, and we all do a lot of that. How do you feel like your posture is?
Ugh, Zach, not so good.
That's why I have a job.
Yeah.
Yeah, that's why I have a job.
I feel like I have a slump. Like when I sit, I slump
Sure,
back.
sure.
Yeah.
So really simple. You don't need expensive equipment. I mean, we found this blanket, rolled it up, bath towel. They do sell lumbar roll pillows that are really affordable. I think they're worth their weight in gold. So what we're going to do is we're just going to place that in the small of your back.
Okay.
and you adjust that as you feel comfortable. But what that does is help support your natural curve of your spine.
I feel better just from this
Good.
blanket.
Yeah, and it does. It provides a tactile reminder to sit well. So you kind of hear me chirping in your ear to sit tall.
Yeah.
Okay.
I could use this at my desk chair.
In your
because we
desk.
sit and we edit a lot. So this would be
Exactly.
perfect.
Exactly. In your car, long commutes. We all do way too much sitting through the day, so this will help support that.
Okay, and so let's see your next move.
Sure. So the exercise that April really benefited from, and one of the more common ones for the patterns that we utilize, is called the sloppy push-up. And once again, you don't really need any equipment. I'm just going to lie down on the floor, get my hands above my head. I'm going to press and lock my elbows. I want to keep the front of the hip down in contact with the mat, and it's a really safe, passive amount of force into my lumbar spine. I'm going to relax and repeat.
Now this is my type of push-up.
Easy. Yeah, it's like a lazy, bad push-up,
Yeah.
right? And what we're going to do with that, and what I prescribe to patients, is to perform about 10 repetitions at a time, and then they want to do that often and frequent through the day.
Now, what if you do something like that and you start to feel pain? Like what level of pain should you feel with that, or should you not be feeling pain at all?
So usually during, it may be uncomfortable, but we're always looking at the after effect, right? So if you lie down, you do 10, you get up. If it's a positive experience for you, then you fall into one of our more common categories of pain, and you'll respond very well to that. If not, we would suggest other options.
Okay, and so how long before you start to see results?
It can be immediate. Yeah, and that's one of the amazing things from a clinical standpoint. We for something very simple, it can be a very quick fix.
Oh, well, thanks so much, Zach. These exercises are so easy. I'll send it back to you, David.
All right, yeah, thank you so much, because that's exciting stuff. And thank you all for being here. We appreciate it. To learn more about back pain care at AHN, go to PittsburghTodayLive.com. We have a link posted for you there. And keep watching for our Eye on Health series here on PTL. It's every other Wednesday, sponsored by Highmark Blue Cross Blue Shield, together with Allegheny Health Network for your health. Well, coming up, cookies, lots of cookies, as local bakers get ready to set a record for the world's largest wedding cookie table. How you can help, that is coming up when PTL comes right back.